Hey everybody, it's Corwin Crandell, patient coach of 11 Health. Hey guys, it's been a long month. Had a couple updates that I would like to share with everybody, let you know what's going on and kind of where things are going from here. Several weeks ago now, I started experiencing a great deal of pain, and I think it was coming from my J-pouch. Mind you, of course, everybody knows I have an ostomy. I got 6, almost 7 years ago now, roughly. Everything's been going great, except for about a year ago I had a slight infection, and doctor had to go do a lower endoscopy and clean out a little bit of that infection, but it wasn't really serious and didn't really hurt a lot. So anyway, a few weeks ago, all of a sudden, I had a day or two where I was in a great deal of pain. I was trying to tough it out like it was no big deal, and by the third day I couldn't get out of bed, I couldn't walk, I couldn't do anything. I had the most excruciating pain emanating from that part of my digestive system. This has been incredibly debilitating, but anyway, they did a thorough job, which I appreciated. If anybody remembers an Instagram post I made in the beginning of all this, I was kind of mentioning that, hey, I finally got over that 165-pound mark that I had lost, all those years ago, since 2001. I finally got back up to the weight I was when all the surgery started. That didn't last very long. Probably lost about 10 pounds since all this has started. So, long story short, last week was supposed to be the testing to get ready for surgery. I failed that test. Infection still wasn't gone yet. I was still experiencing quite a bit of pain, and I had to go another round of antibiotics. So I did that again. And now I've been off the antibiotics for 3 days, and tomorrow morning I go in for the post-op, all the tests. I gotta show up at 11:30 in the morning, do some tests at the surgeon's office, and then go across the street to the hospital at 2 o'clock and do some more tests there. And I'm praying that this time around that they can do the surgery. As you know, I have an ostomy, but I also have a J-pouch because I used to be on the J-pouch for 11 years. I was on the J-pouch before it eventually failed almost 7 years ago now. So the thought always was, maybe I could get reversed at some point in time. So anyway, I am thankful for the ostomy. The ostomy, I believe, saved my life, and it's giving me my life back. I concurred with my doctor. My doctor thought, well, let's give this first surgery. It's a day surgery. I go in, if everything, all the tests go right tomorrow morning and afternoon, I'll go back to the hospital on this Friday, the 28th, and I'll undergo the surgery. So you might be watching this video after my surgery, in which case I'm sure I'll do an update on Instagram. So the thought is we're gonna try something this Friday. If all the testing goes well, he's gonna go in and attempt to clean out and do a little bit of pruning, sort of say. It's kind of a weird way of putting it. I think my surgeon and I are both on the same page now, though. If this doesn't work, I kind of feel like I'm heading towards a proctectomy, and I'll be on the ostomy permanently. I think I'm okay with that. This is a tough decision to make. Maggie, I admire you. Maggie Baldwin kind of made a decision like this. I really admire you, and I think about you when I think about whether or not I want to just go ahead and keep the ostomy. I do feel better, and I am happy. I appreciate you guys. I've gotten some messages from some of my patients. I think you know who you are. If you guys are watching my videos or my Instagram, when you see this, I hope you know I love you guys. I'm gonna get this hammered out and taken care of so I can get back to work, share my experiences hopefully, and give people an opportunity to learn from what I've gone through and what my family has experienced as well. So I'm gonna wrap this up, guys. I appreciate you watching my video, and have a good day, a good evening, good night. Love you guys. Bye-bye.